Welcome to the Orthopedics Wing. Today, we are tackling the heavy hitter of canine lameness, hip dysplasia, or HD. This is one of the most common developmental diseases we see in dogs, and while less frequent, it definitely affects cats too. So, what is it? Fundamentally, hip dysplasia is a failure of development. The coxofemoral joint, the hip, is supposed to be a tight, perfectly fitted ball and socket. In HD, that development goes wrong. The socket is too shallow, or the ball doesn't fit deep enough. This mismatch creates joint laxity, or looseness. Laxity leads to subluxation, the ball popping out. And subluxation causes constant wear and tear, leading to progressive degenerative joint disease, or DJD, and painful osteoarthritis. It is important to remember that HD is multifactorial. It is not just one gene. It is a complex mix of genetics, growth rate, nutrition, and environment. You can have the genes for it, but how you are fed and exercised as a puppy dictates how bad the disease becomes.
To understand the failure in pets, you have to understand the design. The hip is a classic ball and socket joint. The components: the acetabulum, the cup, and the femoral head, the ball. In a healthy hip, these two fit together perfectly. We call this congruency. They are held tight by a firm joint capsule, the ligament of the femoral head, the round ligament, and a heavy suspension system of gluteal muscles. In a dysplastic hip, the primary enemy is laxity. The ligaments are loose and the fit is sloppy. Because the ball isn't seated tightly in the socket, it wobbles with every step. The result? This constant microtrauma causes inflammation. The body tries to stabilize it by laying down new bone, osteophytes, but this just creates a shallow, painful, arthritic joint.
How does a normal hip become a painful arthritic mess? It is a two-step process driven by one thing: laxity. Important distinction: puppies are not born with dysplastic bone changes. They are born with loose hips. The puppy phase, the instability. It starts with the soft tissue. The ligaments and joint capsule become loose. The mechanism: every time the puppy takes a step, the femoral head subluxates or pops out. The damage: this hammering effect causes microfractures on the rim of the socket and wears down the cartilage. The adult phase, the remodeling. Over time, the body tries to stabilize this wobbly joint, but it does a bad job. The result: the joint capsule thickens, or fibrosis. The femoral head flattens out and loses its round shape. The acetabulum becomes shallow. The end game: the body throws down bone spurs, or osteophytes, to stop the movement. This is degenerative joint disease, or DJD, a painful, grinding, mechanical failure. Nature versus nurture. Who is to blame? Clients always ask, is it genetic, or did I do this? The answer is both. The genetics, the gun. Hip dysplasia is a polygenic inherited disorder. The rule: there isn't just one bad hip gene, it is a complex mix. The risk: family history is the strongest predictor. If the parents have bad hips, the puppy is at high risk, even if raised perfectly. The environment, the trigger. Genetics load the gun, but the environment pulls the trigger. You cannot change the dog's DNA, but you can influence the severity. The amplifiers: rapid growth. Pushing a puppy to grow too fast with high-calorie and high-calcium diets is disastrous for joint development. Obesity. Excess weight on soft cartilage is fuel for the fire. The floor. Slippery floors like tile or hardwood prevent muscle development and increase subluxation events. The takeaway: these environmental factors do not cause dysplasia in a genetically normal dog, but they can cripple a dog that was genetically predisposed.
How do you spot a bad hip? It depends entirely on who walks through the door. The signs in a bouncy golden retriever puppy look very different from an elderly cat. In dogs, the signs are usually mechanical and gait-related. Look for the bunny hop gait. When running, they lift both back legs simultaneously to save energy and reduce pain. You might see a swaying, waddling walk or hind limb muscle atrophy, skinny hips because they are shifting all their weight to their front legs. Watch them try to get up. they will have difficulty rising and show stiffness after resting. When you extend that hip backward during a physical exam, they will often vocalize or whip around. That is pain on extension. Cats are different. They are masters of disguise and rarely limp. You have to look for behavioral changes. They won't stop moving, but they will stop vertical movement. They become reluctant to jump onto counters or beds. Look at their lower back. If it is matted and messy, it's because they have difficulty grooming that area due to hip pain. Often, the only sign is irritability when touched, or a general decrease in activity.
Physical examination, the hands-on hunt. Before we take an X-ray, we use our hands. The physical exam is about detecting two things: laxity, or looseness, and pain. The Ortolani test, the gold standard. This is the most famous test for hip laxity, usually done under sedation. The move. You place the dog on its back in dorsal recumbency. You push the femur down, subluxating it, and then slowly abduct the leg, opening it up. The clunk. If the hip is dysplastic, the head of the femur will pop back into the socket with a palpable clunk. That is a positive Ortolani sign. It confirms laxity. The Barlow test. This is the reverse of the Ortolani. The goal. We are trying to see if we can push the hip out of the socket. It tests for subluxation potential. The Barden test. Here, we lift the femur laterally. If it moves too far sideways, it indicates the joint capsule is loose. The pain and gait evaluation. Finally, check the basics. ROM. Extend the hip fully backwards. Resistance or vocalization confirms pain. The grind. Feel for crepitus, that crunchy feeling, which tells you the cartilage is gone and bone is rubbing on bone. The look. Check for pelvic symmetry and muscle wasting. A dysplastic dog often has triangle hips, huge shoulders from overcompensation, and withered hindquarters.
Diagnostic imaging, the truth in black and white. The physical exam gives us a suspicion, but imaging gives us the proof. When we talk about hip dysplasia, we are usually talking about two main screening methods, OFA and pen hip. 1. Standard radiographs, the VD view. First, the basics. We take a standard ventrolateral, or VD, hip extended view. What we look for. We want to see a deep, round socket covering at least 50% of the ball. The red flags. In a dysplastic dog, you see a shallow acetabulum, a flattened femoral head, and subluxation. The Morgan line. Look for the Morgan line, a specific osteophyte formation on the femoral neck. It is one of the earliest radiographic signs of trouble. 2. OFA, the traditional standard. The Orthopedic Foundation for Animals, or OFA, is the most common certification in the U.S. The rule. The dog must be 2 years old to get a final grade. The grades. It is a subjective assessment by radiologists. They grade hips from excellent, good, fair, passing, to borderline or mild, moderate, or severe dysplasia, failing. 3. Pen hip, the early warning system. Pen hip is different. It doesn't just look at arthritis, it measures laxity. The mechanic. It uses a stress radiograph to push the hips out and measure how loose they are. This gives us a number called the distraction index, or DI. The numbers. A DI of less than 0.3 is tight and excellent. A DI of greater than 0.7 means high laxity and a high risk of arthritis. The advantage. We can do this as young as 16 weeks. This is critical for breeders deciding which puppies to keep or owners wanting to start preventative care early. 4. CT and MRI. Finally, while rare for simple dysplasia, we use CT or MRI if we suspect the pain is actually coming from the spine, like cauda equina syndrome, or if we are planning complex 3D surgical correction.
So we have the diagnosis. Now, what do we do? For many patients, especially older dogs, cats, or mild cases, we start with conservative management. This is a multimodal approach. You can't just give a pill and walk away. You have to change the lifestyle. 1. Weight management, the holy grail. This is, without a doubt, the single most important factor. The physics. Excess weight is a force multiplier on a bad joint. The goal. We need these dogs lean. Getting a dog to a healthy body condition score, BCS 4 out of 9, often reduces lameness better than any drug on the shelf. 2. Controlled exercise. We don't want them sedentary, which causes muscle atrophy, but we need to stop the high-impact pounding. The do's. Leash walking and swimming are perfect. They build muscle without the concussion. The don'ts. No chasing balls, no frisbee, and no jumping out of trucks. 3. The pharmacy. NSAIDs. To break the pain cycle, we use non-steroidal anti-inflammatories. The common players: carprofen, Rimadyl, meloxicam, Metacam, and daracoxib. These reduce the inflammation that drives the arthritis. 4. The supplements. We add building blocks for the joint. The oils. High-dose omega-3 fatty acids are fantastic natural anti-inflammatories. The injectable. Adequan, polysulfated glycosaminoglycan, is a game-changer. It inhibits cartilage degradation and stimulates repair. The oral. We also use glucosamine chondroitin and green-lipped mussel. 5. Physical therapy. Finally, professional rehab. Hydrotherapy, underwater treadmill, and laser therapy can drastically improve range of motion and comfort without surgery.
When weight loss and pills aren't enough, or if we catch the problem early enough, we turn to surgery. We divide these surgeries into 2 categories: preventative, saving the hip, and salvage, replacing the hip. The puppy prevention. JPS, or juvenile pubic symphysiodesis. This is a timing game. It must be done in puppies less than 16 to 20 weeks old. If you wait too long, the growth plates close and it won't work. We prematurely fuse the bottom of the pelvis. As the rest of the pelvis grows, it rotates the sockets outward, essentially capturing the femoral heads better. This is for the 4-month-old puppy with a high distraction index, or loose hips, but no arthritis yet. The realignment. TPO, or triple pelvic osteotomy. This is the next step up for young dogs less than 1 year old. They must have laxity, a positive Ortolani sign, but no arthritis. Once arthritis starts, this surgery is off the table. We cut the pelvis in 3 places and physically rotate the cup to cover the ball. It saves the natural joint. The salvage. FHO, or femoral head ostectomy. If the hip is already destroyed, we just remove the source of the pain. We cut off the femoral head entirely. The body forms a false joint out of scar tissue. This is fantastic for cats and small dogs. They do very well. In giant breeds, it's less ideal because the false joint struggles to support 100+ pounds. But it is a valid, low-cost option if a replacement isn't affordable. The gold standard, THR, or total hip replacement. This is the bionic solution. Just like in humans, we remove the bad joint and implant a titanium stem and a polyethylene cup. This provides a pain-free, mechanically perfect joint with excellent range of motion. It is expensive and requires a board-certified surgeon, but for a young, active, large-breed dog with severe dysplasia, it gives them their life back.
Prognosis and pet parents' education. For dogs with strict weight control, mild cases can live happy, active lives. Severe cases often require surgery, but the success rates are high. Total hip replacement, THR, has a 90 to 95% excellent outcome rate. It basically cures the problem. FHO, good for small dogs and cats, but large breeds may have a permanent limp. For cats, they often cope better simply because they are lighter and don't rely on sustained trotting. But do not be fooled, they still feel the arthritis and need pain management. Prevention. Stop rapid growth in puppies. Use large breed puppy formulas designed to control calcium and calories. Screen breeding animals. If the parents have bad hips, do not breed them. Hardwood and tile are slippery. Soft, thick beds, not just thin blankets.